I think one of the most important things to understand is the size and the scale of the military health system. So there are a lot of bright and shiny objects out there in the IT space, and it's really difficult to find the technologies that are really going to be meaningful and impactful on that scale. So, for us, quite honestly, we're in the middle and we're really on the edge of a cloud strategy that is really going to transform the way we deliver applications and data across the enterprise. It'll help us reshape our hosting, provide more stability to the applications that we have. It'll provide an opportunity to really sort of provide or create a foundation for which we could start to work on more deeper, more advanced technologies like AI and other areas in analytics to go from descriptive and even predictive analytics into the real prescriptive things that happen at the bedside. And one of the important things to think about is our scale. So I'm really only interested in technologies that we can implement at that level. So thinking through the long-term effects of putting plans in place today that really are only going to come to fruition many years down the road. That's the tactics of this business, that's the art of this business, and being able to set up the organization of this size for advancements down the road. So we are a Agile first organization. One of the things that is incredibly important is we have to live and be comfortable with a world of ambiguity, right? The requirement continues to change, the environment we work in continues to change. So Agile really sort of helps you adopt that and gives you a framework to be comfortable with it. So that's one of the things that is incredibly important to the way we develop software with our vendors and the government side going forward. I think the importance of security in our space is paramount. We have our hands on and are the guardians of lots of patient information. Patient privacy is always paramount in any part of the healthcare business. So the challenges are really twofold. One is a cost challenge. The complexity of attacks against our networks really around the globe continue to increase, and our defenses therefore have increased as well, and along with that comes cost, and really an opportunity cost to be able to use that money on either enhancements or other improvements that we may want to make. The second part is really usability. So we always keep our users in mind. We have 150,000 users around the globe. We have another 9 million patient beneficiaries that use our patient-facing tools. And the dynamic tension that exists between usability and cybersecurity is something that is very real. So we want to make sure that our tools are still usable while safe at the same time. And this is a very exciting project for the military health system and really for the Department of Defense. MHS Genesis is a modernization of our electronic health record. So our current electronic health record dates back to the late 1980s. And it comes in several different components and parts. So the MHS Genesis project is an adoption of a commercial electronic health record used throughout the globe, and the adoption of that inside the DoD. Our role in that is really one of transition. We're in an incredibly risky time and very early time in this transition. So when you're moving from one product to the next, you create a lot of risk there. So I have my team really focused on a core mantra that there's no patient that's going to be left behind. The last base, the last clinic, the last patient encounter matters just as much as the first one in MHS Genesis. That's really the art of this business, right? Integration and working with stakeholders and working with different groups. We have a number of strategic partners we work with other parts of the DoD, certainly parts with the VA. We have a number of projects with the VA now that we're very excited about. They are adopting a number of our pieces of technology. We share data with them at a level we've never shared data with the VA before. One of our core projects today is connecting all of that purchase care from the outside. Sometimes upwards of 60% of our healthcare is purchased from our TRICARE network. And right now, we are in the middle of a project, really through the Office of the National Coordinator, to start to connect all those different health information exchanges around the U.S. to provide a full picture to our providers of all the patients' data. I always remind folks that this is a team sport. So there is always this common misconception, I think, that there are a bunch of technologists sitting in the back that are just throwing technology out into the environment and hoping it sticks, right? We on my leadership team today, we have a number of physicians and nurses that are part of that team, and those types of people are spread out through the organization. So when we make decisions from a technology perspective, they are done so with the user and with the sort of workflow and the clinical environment in mind. The use of clinical informatics and informaticists in our environment are incredibly important. These are administrative professionals, clinical professionals of all shapes and sizes that are trained in informatics and understand how to put technology and implement it into a workspace. We talked about cloud earlier. In addition to the classic things people think about cloud computing, there are a number of microservices and other back-end services we intend to build that'll support and improve really sort of the applications in the portfolio today, but also our mobile environment that is starting to really take on and grow. But the two big projects I wanted to mention is the connected to cloud as well as our defense medical logistics system. It is currently a federated architecture across the globe. We're going to bring down that architecture, move it into the cloud, and be able to really sort of leverage that cloud computing technology and that generate value and some savings there. The other piece is on data. We have had a lot of movement in this space. The state of data in the MHS, as I mentioned earlier, has never been better than it is today, but I think we've got a long way to go. So we continue to consolidate our data activities into a single organization. We have some rationalization that will go along there to really put in master data management principles, define sources of truth, and really begin to enable our users in the field to take advantage of centralized tools that we have in the toolbox to do the descriptives and the predictive analytics we talked about before, but really get to a point where prescriptive analytics are the norm and they're available to anyone in the inventory. So if you think about it, what we really create there is an environment where users can come in, grab the data that they need, grab the tools that they need, and provide the visualization back to their stakeholders in a centralized way. It's crowdsourcing. If you think about it, our best ideas really kind of come out of the field. We have 150,000 users in the military health system who have great ideas, have great thoughts, and have really a passion for getting after answers. And we want to be able to provide a data environment that supports those kinds of initiatives and that kind of thinking.